Hello, I'm Dr. Igor Simonov, and today I will continue talk about the method Zhou, which means give and receive, which mentioned in a few parts of Nan-Jing. But today I will talk, if previous time I was talking about the direction of the needling for the managing of qi. Today I will talk of the direction of the movement of the needle. So it was the picture from the last video where you can see, for example, that qi in the yin meridians of the Zhang organs flow in this direction, and the four organs flow in this direction. So for example, once we were using doing the needling of the small intestine meridian, which was according to the pulse diagnosis, movement of the earth instead movement of the fire. So we were using needling in direction of movement of the qi. What does it mean? We actually used point of the earth close to the elbow of the small intestine meridian, and the needle was inserted till the earth level in this direction. So actually qi could move from the earth up, restore its movement from the earth to the fire, movement of the small intestine. So for example, if it would be like the meridians on the leg, we'll see, for example, here it was the gallbladder meridian, movement of the earth to, so direction of the four meridians go this way. So movement of the gallbladder is not the earth but the wood. So what we would need to do, we would need to produce puncture till the wood, and the movement, it will restore movement from the earth to the wood, deep insertion. And for example, urinary bladder meridian has the movement over the fire, so we would use movement over the fire in urinary bladder meridian, fire point, but we would need to send it to the water, because the movement over the urinary bladder meridian is the water, so direction would go from the fire to the water. And for example, stomach meridian had the movement of the water, so we would need to use the water point of the stomach meridian, which we were using, and we would do the insertion in this direction. So water movement would restore in the earth movement. But it's important because this method, it's not like the bu-xie, so it's just we receive energy from one meridian, one movement, receive one movement and transform it to give it to another movement. So in this method, it's important also direction of the movement of the needle. So first of all, we will check, we have the like the plan of the palace of the king's palace of the one of Zhou dynasty. So where we can see the important direction. So here we can see it is the east. We see the tree and the sun is rising and appearing under the branches of the trees. This is the south. So what we can see, the place with the big vegetation. And here we have the north, which is important. We can see the two people standing back to back. So actually where our back direction of our back should be, we should be standing back to the north. And here is the west. So in this Zhou palace, we can see first of all is Nan-Jing. It is the south gates. From the south gate we would come directly to the Da-Tin large yard. From Da-Tin, if we follow through, we will go to the palace temple of the ancestor Da Miao, and after that, if we will go through, we will see the second gate, Ming, and from the second gate we actually come to the middle, the central yard, Juntin, and from the central yard we actually come directly to the palace, big palace Da-Xi. So whatever was happening in the palace, for example, if it was the divination about the weather, for example, if it will be rain, it will not be rain. So for example, person who was giving the divination in this palace was standing facing to the north, because the emperor was always facing to the south. And when the person who was giving divination was telling, for example, tomorrow will be the rain, emperor always was saying, emperor, answer, tomorrow will be rain. If it would be, for example, some orders about the managing the country, so emperor would be sitting on his throne, again facing back to the north, face to the south, and all people would be standing facing to the emperor, facing to the north. So emperor would be giving his orders and the directions facing to the south, facing to the movement of the qi, because actually sun would be visible, and movement of the sun would be from the east to the west. So it means it would be actually direction from the east, south and west. So this is the movement. So if we will take, for example, like the diagram, which the same, we have the east, west, south and north, and here is the point of acupuncture, point 2-way. So what we can see, this is the place, center place, like the same like we saw in the palace, center place. It would be point of acupuncture. It's where man is standing, and this is the, we'll say, the place for the well, place for the hole, a place for the cave where the puncture should happen. So once we introduce the needle, again, it's not place, it's not the whole acupuncture point, it's not the well, it's the place for the well. So introducing the needle in the acupuncture point would produce this well, I would produce this hole. And if we like to, as we said before, for example, make that qi from the surface go deep, what we need to do, we need to follow direction from the east, south, west. So direction over the movement of the needle should be like that. If we will like opposite from the deep, we like to move qi to the surface, so direction of the needle should be opposite, contra clockwise. So this method now is used like the bu-xie, but actually it comes in much earlier methods of the puncture. Of course, if we are on the southern hemisphere, so what is happening in the southern hemisphere? So the sun, we need to face actually the north, because the sun will be going from the, and we will see the sun only facing the north. So sun will be going from the east to the west. So if we need to send the qi deep, we need to do this direction, and if we need to resurface it, we need to do opposite direction. So with our patient, we were using as patient, and the treatment was done in the southern hemisphere, was made like for the southern hemisphere. And if we will look, for example, the map, pulse map of this patient, we can see that actually what happened, the small intestine actually restored, stomach deficiency become less, excess of gallbladder actually returned to its normal movement, Sanjiao returned to its normal movement, and urinary bladder moved very close to its normal movement. So it is why patients straight away after the treatment feel no pain anymore, and she had the very feeling that she is very strong, lot of energy, and she was still under few more treatments for her arthritis, but to improve her, restore her pulse, but really she had not any more pain in her knees, arthritic pains. Thank you.